Last but not least, let's talk about the arterial system in the pelvis. It's actually quite easy, and if you can figure out the arterial system, then it's, again, remember the mirrored vessels in the vein mirror the vessels in the artery. So we'll start with the aorta, dead center. We're going to go down. It's going to bifurcate. There's your bifurcation. My aorta has now bifurcated or branched off into the right common iliac and left common iliac. Okay, so I now have this. Remember that short stub where it's going to travel laterally to my right and left sides. Here's my right, here's my left, and then it's going to bifurcate again almost immediately. And here's where it bifurcated again, right about here, to my external iliac and my internal iliac. Okay, external, internal, two separate vessels here. Left on this side, right on this side. And remember that the external is going to now travel anteriorly and eventually become the femoral artery, and the internal is going to travel posteriorly and provide most of the blood flow for the visceral organs of the pelvis. It's going to travel back to the sacrum here. So let's follow it down, and you can see there's your internal. It took a sharp turn to the back, and it's now going to branch off a bunch of different times to feed all these different branches and all the different organs. Whereas the external, its main job is to travel down and be the main conduit for arterial blood flow to the extremity. So right here, we are the femoral artery. Okay, again, remember, right over the femoral head, you would access right here for a vascular study. Nice straight shot, no bifurcations here, not a lot of branches. And when I need to compress to clot off that artery, I have a nice bony substance right here to clot it, to push it against. So let's go back up. We'll follow the right side. Okay, aorta, bifurcation, right common iliac. It travels across the inferior vena cava, that's also splitting. And then now is going to become external and internal iliac arteries. Okay, internal traveling back. It's going to feed the blood supply posteriorly. My external travels anterior, becomes femoral artery, travels down the right extremity. Okay, and now that we went over that anatomy, this big guy, remember, the venous system is always medial to the arterial system down here in the extremities. So the femoral vein is always going to be medial to the femoral artery. Okay, and that comes into play. Remember, we talked about if you had to access the vein for, say, insertion of an IVC filter, you would feel for the femoral artery and go just medial to that, to this nice big guy here. Veins are always bigger than arteries. Here we go. Let's go back. Inferior vena cava. Going down, it's branched. Here's your left common iliac vein, right common iliac. It's going to branch again to internal vein, external vein. Let's follow the other side. Internal vein, external vein. Mimics and mirrors its sister artery or brother artery, whichever you prefer. And here now we have our external iliac vein that's become the femoral vein of the left side, and the external iliac vein on the right that has become the femoral vein on the right. Okay, so pretty easy if you follow, the mirror the right and left. And last but not least, I just want to point out some inguinal lymph nodes here. Here's a lymph node right here, this guy, here's a lymph node right here. Anything that comes in and goes out, okay? If it's something you can follow down, it's probably a vessel. This guy right here, he's a little tube, and then he's a bubble, and then he goes away. These are all superficial inguinal lymph nodes, these little guys. Okay, remember, you can feel them and see them on a fairly thin patient. This is a fairly thin patient. These little bubbles that go in and out. Okay, not these other things, like see this guy, I can follow this guy all the way here, and he actually looks like he has a branch. Okay, that's not a lymph node. Anything that's a bubble in and bubble out, lymph node. Okay, over here, let's see, bubble in, bubble out, lymph node. All right, so superficial inguinal lymph nodes. Okay, and remember the lymph system follows all these major vessels. So if you look, especially superficially in the inguinal area, which this is the inguinal area, the groin area, you're going to see it's scattered with all of these lymph nodes. Refer back to your text, page, hang on, 561. You can see how all of these nodes follow right along these major arteries or these and veins right along the major vessels. So very easy to see down here.